If you want access to my entire library of past webinars, as well as access to future ones, head over to daringventuresathome.com or click the link in the description below. Recovery often begins by necessity with a greater emphasis on structure framed in absolutes. So for example, you're sober or you're not. We can get into all kind of intricacies about how you define sober, and it's so much harder with sex addiction than, for example, alcohol, because you either take a drink or you don't. You know, with sex addiction, I don't have to drink alcohol, right? And I've got a drug that I'm carrying around in my own mind. But there is a reality to that. And I don't get into all that nuance with guys who are new in or women who are new in addiction recovery. All right, we're going to define sobriety and we're not going to renegotiate it. Or you're committed or not. And I've in the past, I mean, that's an intervention I've used. I look her in the eye and tell her, I'm all in. Are you all in? Are you all in or not? I'm not saying that's a bad thing. These are things that are often necessary. These are ways we frame things at the front end of addiction recovery. The big book of AA, in probably the most famous chapter of the book, called How It Works. It's often read. This section of this chapter is pretty lengthy. At the beginning of 12-step meetings, they read this thing called How It Works. There's a line in there and it says, half measures availed us nothing. We must give ourselves wholeheartedly to this simple process of recovery. I'm all in on this. I'm going to do it. I'm going to give it all. I'm going to leave it all on the field. We could talk about people. He's either in recovery or not. She's in recovery or not. We say this, and again, I believe it. The betrayed partner is neither the cause or cure for the acting out behavior of the betraying partner. That is a true statement. It's also an all or nothing statement. Often, early on, boundaries are set as non-negotiables, and rightly so. If I learn you have sexually abused our children, I'm out. Now, I want to add a caveat that sex addicts are not identified and always sex offenders. There's two completely different pathologies where there is sometimes overlap, but it's an understandable fear that betrayed partners have, because my gosh, I don't even know who you are anymore. If you refuse to work a recovery program, see a therapist, acknowledge this is a problem, I'm out. When we start recovery, these absolutes are crucial. Now, they come at the addicted partner or the betraying partner a lot harder than they should come at the betrayed partner. It's still a reality there. So I'm telling, early on, I'm saying to a betrayed partner things like, it will be your ability to vocalize your needs and learn how to do self-care and learn how to set and hold a boundary that is going to make a difference in whether this relationship will make it or not. That's if he gets on board. But often it is you doing this that will be the thing where he wakes up with capital R reality and gets on board. There are these big all or nothing sort of concepts and ideas and statements that we make early on in recovery. Recovery that gets stuck, though, in rigid structure ends up creating a deficit in psychological flexibility, which results in poor quality of life. What often happens is people start, rightly, understandably, in this more rigid place, this place of absolutes, but they don't move out of it. They stay there. They become overly reliant on the rigidity and on the black and white thinking, on the absolutes for their own sense of safety or their own sense of well-being or progress. And they don't take that as a launching point to move toward that psychological flexibility. And the result is, like it says here, poor quality of life. So this is all, again, you can look this up, look up the studies. There's tons of research out there about that. When you don't have psychological flexibility, what needs to happen is that boundaries can also be requests, not only rules, right? And they need to be presented as requests, because the reality is the person does have a choice. I can't make you do anything. You can't make your partner do anything. And so psychological flexibility is a point of, says with boundaries, hey, this is an important request that you can choose to honor or not. Now, based on your choice, I get to make my next choice. But we all have choices. Trauma symptoms are managed, not resolved. So again, if I get stuck in that rigidity, I'm only trying to manage trauma symptoms. I'm trying to manage them by avoiding triggers and this sort of thing. Okay. But I'm not actually resolving the trauma triggers. I'm not actually getting to the healing of what's causing trauma triggers, right? I'm just chopping at dandelions, not getting to the root. That deficit in psychological flexibility results in lower quality of life, increased distress and sickness. That's what the research shows. When you don't have that psychological flexibility, the sense of psychological distress, anxiety, dis-ease is all higher. Lower levels of relationship satisfaction. So when you don't have psychological flexibility, what people report is they don't like their relationships as much. They find less satisfaction in their relationships. They're less healthy.